Hi everyone, welcome. Hope everyone is having a good day, good week. We'll give everyone a second to join. Thanks for being here today. Welcome to session 8 of our Northeast CPI. Kind of hard to believe that we're approaching the end of August, but I hope everyone is doing really well. We can go to the next slide. So please, everyone, update your Zoom name. As always, feel free to come off mute and share throughout this session. We're going to have some points later on in the session where we'd really love to hear from you. So please, put stuff in the chat, come off mute. Feel free to engage in whatever way makes sense for you today. And our icebreaker for today is, what are you looking forward to? What's something maybe this weekend, next week, next month, um, over kind of the next season, something that you're looking forward to. So feel free to pop that in the chat if you have anything you want to share. And if not, that's fine too. Some days it's harder to find the things to look forward to. Oh, that is so nice, Marcy. That's one of my things that brings me so much joy is having like a clean house, a clean space. Like it really does wonders for my well-being. So I feel that. Cooler weather, yeah, definitely. Family coming into town. Oh, that's awesome, Sierra. 3-day weekend, yeah, I'm really looking forward to that too. Sleep, definitely. I personally am having dinner with a high school friend tonight that I haven't seen in a while, so I'm really looking forward to that. But I hope everyone is looking forward to those bright spots and that you all get some rest this weekend or next weekend with the long weekend. We can go to the next slide. So welcome everyone. Do we have any new folks today? If you are new to the space, hi Sarah. Great, welcome. For those of you that are new to the Northeast CPI, this is a space for CalAIM stakeholders to really come together, collaborate, talk about challenges, problem solve, and really with the overarching goal of improving CalAIM implementation and utilization. Oh, that's awesome. It's great to see all the new folks in the room. If you have any questions throughout the session, please always feel free to come off mute or put a question in the chat. We're here to work together and really happy that you are joining us today. Next slide, please. Okay, so for the agenda today, after this, we will move into some general DHCS policy updates. We'll have some updates from partnership. And then we have 2 different provider spotlights today, which is exciting, one from About Time Recovery and one from Malama Health. So we're really happy that they'll be joining us. And then we're going to have sort of a primer for a bigger conversation we're going to have about sustainability during the in-person session next month. But we're going to talk about the concept paper that was released last month, kind of go over some of the key points. There is an opportunity for you all to provide feedback and comments. And so we'll kind of talk about what that looks like and then sort of do like a little primer introduction to a bigger conversation about sustainability that we'll be having next month. And then we'll provide more details about that session that's happening in September, and then talk about next steps in terms of office hours and one-on-ones. Next slide, please. So our objectives for today are to, review these important policy updates from DHCS and partnership. We'll hear from some local providers, learn about their successes, best practices, lessons learned. We'll talk about that DHCS concept paper and introduce that sustainability conversation. And then you all will receive additional details about the upcoming in-person session in September, including agenda, registration, all of that good stuff. Next slide, please. All right, so we'll move into some of our updates for today. Next slide. So the first one is a resource to kind of help increase your understanding of the impacts of HR1. I know there are a lot of details, a lot of implications, and I know that you all and we are trying to kind of, understand what's happening, what the impacts will look like. And so really wanted to share with you a webinar or a presentation on navigating federal cuts to health and human services in California. And this webinar provides an overview of the federal cuts to programs in California, focusing on potential effects to Medi-Cal, Covered California, and CalFresh beneficiaries. It talks about the timeline for policy changes, anticipated enrollment impacts, and some ways that we can navigate these transitions. And Navneet put the link to that presentation in the chat. And then, as always, you all will receive these slides afterwards that'll have the resources linked as well. And then the second document here is a helpful resource that provides an overview of the changes that Medi-Cal members can expect with eligibility and benefits through 2026 to 2027. And that is in the chat as well now. Next slide, please. So we also wanted to provide an update about the all plan letter that was issued on July 31st by DHCS. And this letter provides guidance to Medi-Cal managed care plans on the handling of payments and claims to Medi-Cal and family planning access care and treatment program providers who may be impacted by HR1. So DHCS will continue to communicate any additional information to what are now kind of considered quote unquote prohibited entities, which are those family planning providers. But there's also additional details in the all plan letter about exactly what constitutes a prohibited entity. So be sure to look at that. But they'll continue to communicate any additional information through regular communication channels and updated policy guidance, and we'll be sure to share that as we receive more as well. And then, as always, for any questions about this guidance, you can email DHCS's Office of Family Planning, and that email is in the slide. Next slide, please. So Health Begins created some cards that can help, providers kind of navigate everything that's happening right now with healthcare and immigration. And you can learn how your institution can respond to the threat of aggressive immigration enforcement and ICE raids in your community. These cards are sort of a resource that you can use for practical steps for your institution to take in order to protect immigration communities and preserve access and quality care. These can be posted, they can be used for learning purposes, they can be shared with other partners in the space. And the goal here is to, make kind of the information as easily accessible as possible, and also create sort of a streamlined version so that folks can really get to the key information right away. So those cards are in the chat, so please feel free to take a look at those and share them with anyone that could benefit. We also wanted to provide an update on the DHCS County Office Locator tool. They launched an enhanced version of this tool to improve the user experience for Medi-Cal members and stakeholders. And this replaces the previous list of county offices with an interactive component to the map. So users can now search for their local county office by entering a zip code or a county name or enabling location services. And search results include office address, phone number, direct links to official county websites, and a get directions link for easy navigation as well. All right, and now I'm going to pass it over to Alyssa and Josh, I believe, to talk about our updates from partnership. Thank you.
Hi, everyone. Are you able to hear me? I'm hoping yes.
Sounds good.
Perfect. All righty. So my name is Alyssa Sawiris. I am a project coordinator here with the ECM team at Partnership, and I'm going to go ahead and give you our CalAIM update. Next slide, please. So for today's agenda, we're going to be doing a recap of the community supports policy updates, closed loop referral information, member rights, grievances, and best practices, and a friendly reminder on place of service billing requirements. Next. So we're just sharing the DHCS community supports policy changes again. The state has indicated that there's going to be more changes in the fall of 2026. Effective January 1st, 2025, there is now a global cap for what DHCS is calling room and board services, which includes recuperative care, short-term post-hospitalization housing, and transitional rent when it goes live in January 2026. Next slide, please. For transitional rent, we are meeting with each county to partner on the implementation, which again goes live January 1st, 2026. For closed loop referral requirements, Partnership has a responsibility to monitor and track community-based ECM and CS referrals from start to finish. We are currently working through the closed loop referral requirements and plan to notify the referral sources. Please note that we do rely heavily upon our ECM and CS providers and their monthly reporting to ensure that the referral loop is closed. That being said, we have revised our ECM and CS reporting files to reflect those requirements. Next slide, please. And as I previously said, we have updated our various reporting templates to account for the CLR requirements, and this is just a friendly reminder of the updates that we've made to those files. So we want to remind providers that members have specific rights and may file grievances when they're faced with service problems or are unhappy with the services that they have received. Partnership does have a grievance and appeals department to support our members. The Enhanced Health Services team here at Partnership may reach out to you for any specific information pertaining to a member who has received services. And as a best practice, it's always good to respond timely, take a neutral stance, and provide any relevant facts. Next slide, please. And just another friendly reminder that DHCS is requiring ECM and CS providers to submit place of service codes that indicate where the services were rendered. The place of service codes are 2 digits and used in medical billing. We have listed some examples here, but we're also providing the CMS tool for more details and specifics on codes and descriptions. Please note that our ECM and CS billing templates have also been updated to reflect the place of service change as well. And that's all I have for you today, so I'm going to go ahead and open up the floor to any questions.
Hi, good afternoon, Alice. Oh, can I go? Sorry. Hi, good afternoon. Can you just go back to your very first slide? I somehow missed that. I just heard you said there'll be another set of changes come fall of 2026 or 2025. What did I miss? Please.
In 2026, yeah, they have indicated that there are going to be more changes in the fall of 2026. Personally, I don't know exactly what those changes are going to look like, but if you have questions, you can always reach out to our help desk that are listed there on that question slide. And then, of course, our organization will notify you guys with any updates that come through to us too.
Okay. And then lastly, for the POS point of service, is that new information that they have, I guess what I'm trying to figure out, have they changed any of the codes for the services? Because I was talking to my billing personnel, and that was her question, like has anything changed?
So I'm not sure if anything has changed as far as the other codes. I know that we used to use 99 for a lot of them, but that is no longer what we have been directed to use. I can't say specifically if anything else has changed, but if you have questions on those place of service codes or like medical billing or anything like that for the program, you can reach out to our claims help desk, which is also there on that question slide.
Right. So they're no longer using the 99 code.
To my understanding, correct.
Thank you so much. I appreciate it.
Yeah.
Hi, Alyssa. This is Amy from Alama Health. We're an ACM provider for the birth equity population. My quick question is regarding the housing deposits updates. If you don't mind going back a few more slides, I think you had one for it. Yeah, okay. Let's see. Maybe the next slide.
The next
There
one.
we go.
Yeah, there it is.
So housing deposits, the clarification is they do not include first and last month rent, but I want to clarify that security deposits continue to be in scope. Is that correct?
Unfortunately, I can't really speak to the community supports programs as far as housing deposits. I would be happy to connect you with our community supports team, though, who would be able to give you more information on that.
Okay, sure. Sounds great. Thank you.
Beautiful.
And it looks like there's a question from Crystal in the chat asking, do we receive feedback or an outcome from filed grievances?
Unfortunately, I'm not sure. Our grievance and appeals department, basically what happens is they reach out to us and they direct us on the information that they need. And then we go ahead and touch base with our providers or whoever it is that we need to get in contact with. And we provide them with that information that we receive back from the providers. After that, I'm not really sure what their process is, to be honest.
Thanks, Alyssa. Any other questions? All right. Well, thank you so much.
Thank you.
All right. So now we're going to move into our first provider spotlight, and I will pass it over to Tyler at About Time Recovery.
Thanks. Can you hear me all right?
Yep.
Okay. So yeah, we're About Time Recovery. We're a 12-step social model-based sober living environment. We operate 2 women's homes and 11 men's homes. They're all within Reading. They're all in the downtown area too, pretty close to services. Our populations of focus are mainly substance use disorder and justice involved people. We've operated now for 15 or 16 years. And we started out as just a private sober living, all privately funded, and then branched out into county contracts and contracts with CDCR. And just recently, as of almost a year, it's been 10 months with partnership as part of the CalAIM program. Contact info is here. So for best practices, one of the things that we feel we have down pretty well is the sober living part, but the housing navigation, getting people into housing was completely foreign to us, and we had to build that up from scratch. So what we found is just meeting with clients one-on-one has been really helpful. Dragging them into the office, going and meeting them on site, whether that be with our housing navigation meetings. Our house managers also meet with them one-on-one each week. And being able to walk them through the process and kind of meet with them where they're at and direct them. Because we thought about like trying to set up a class thing, and it just seemed impersonal. So this has been pretty good, and we've had a lot of success with it. And people don't feel like they slip through the cracks this way. They know that someone has their back, and that's been really good. The services we offer are short-term post-hospitalization, housing transition navigation, housing deposits, and housing tenancy and sustaining. I think the biggest challenge we face, like I said, and the thing that we've been most difficult with is housing transition navigation. It was completely new to us. Limited timeframes, 182 days to get someone from on the streets or coming out of jail into permanent housing is a very tough stipulation. And we have been successful in some cases, but it is a pretty difficult endeavor, especially with housing prices the way that they are right now. So we've had to get very creative with that. Referral process is just to reach out through me to me through email. I do oversee intakes. I can also send out assessment forms as well. So if you have someone who's struggling with addiction, alcoholism, and needs housing immediately, we're pretty fast on the intake process. I'm pretty proud of that. We have a 1 or 2 day turnaround for getting someone in if everything lines up. I think that's about it. Does anyone have any questions? Wonderful.
I have a question.
Yeah.
To refer over, they don't need to go through what is the 1-800 number that people would have to check in through to get into a recovery home? They don't need to do that anymore. They just contact you straight. It's
Yeah, they can call.
it was a 1-800 it was called Beacon before. It was called Beacon before.
Okay, so that's a really great question. So Beacon, and this isn't my specialty, but that is for more residential treatment, as I believe who bills through Beacon. Uh,
Oh, okay.
we're sober living
Got
only,
it.
so we can do direct contact for referrals, and we'll do an assessment and set up an interview on the spot to see if they're a good fit for the program.
Oh, perfect. Thank you.
Mm-hmm.
Any other questions for Tyler? All right. Well, thank you so much for sharing, Tyler. All right. And then now I will pass it over to Malama Health, and I think I'll pass it over to Amy.
Hi, Eva. Thank you. Hi, everybody. Like I said earlier, we are a enhanced care management provider in network with Partnership Health Plan, specifically designated for mothers. And when translated into the plan requirements, it's the birth equity population. So this is specifically for Black, Native American, Pacific Islander mothers who can use that extra support. And what I want to quickly emphasize here is all of our ECM lead care managers are also trained as doulas, so they have that maternal care knowledge. So let's go to the next slide. And this is going to be a long slide deck compared to Tyler, but let me quickly go through some of this. What we do is embodied by our name, which in Hawaiian means to take care of, to tend for, to preserve and protect. So we really see that as what we're doing. Eva, you can go to the next slide. So this is quick overview of our model. We have two wings of our model. We have a digital app that allows mothers to track their gestational diabetes and gestational hypertension data and share that with their providers if they want to. And that is separate from our local doula care navigator care manager who are on the ground providing that ECM support with the mothers. Let's go to the next slide. Want to quickly showcase this to everybody that joining Malama is pretty quick and easy. The mothers can fill out a quick HIPAA compliant form. Once that form comes into us, our team of LCMs will quickly verify eligibility and then match them with that local care manager. And then we start working with them as soon as we can. And I have a member journey, like an example shortly to share the details. Next slides, please. I'm sure a lot of us here are familiar with what ECM offers, but from a birth equity lens, these are the specific programs that we focus on. So number one is definitely health management. So we encourage them to use the app, and we enroll them in the free education resources that health plans provide. So partnership provides. And we also do a lot of referrals for baby supplies, for childcare, for meals and nutrition, making use of those medically tailored meals, community supports, referrals. And then kind of linking to what Tyler was talking about, we also make a lot of housing navigation, housing tenancy sustaining referrals. So we actually work with community supports partners like Tyler's organization, just liaisoning with them to make sure the member's case move forward. And then a lot of the other things like making appointments for members, teaching them about the transportation benefits, just so that they can make the most use of their health plan to meet their health needs. Next slides, please. So quickly here again, who qualifies in case you may have a mother patient who can benefit from Malama. This is anyone who's pregnant, postpartum, or have experienced a loss or termination. That's something that most people don't think of, is this program is available to mothers who are within that 1 year of postpartum or loss or termination. So it's a pretty long program. They do have to be on the Medi-Cal managed care plan, and they have to fall under one of these birth equity population. So either Black, Alaskan Native American, or Pacific Islander. Any questions, or anyone who have seen mothers or worked with mothers or the birth equity population in general?
Hi. Oh, hi, Amy. Sorry.
Mhm.
That, I read the birth equity and I think my team has it incorrect because we have pregnant moms, but I think what we're missing is the ethnicity part of it. And I don't think any of our moms we've had fall into that ethnicity part. So maybe we are not doing the birth equity as we thought we were.
Ooh.
So, but we do have moms, and I think right now, I think we have like 2 or 3 moms enrolled in our ECM program, but they don't fit into that birth equity. That ethnicity population is what I meant.
Yeah, I would, this is definitely a question for that, for your managed care plan. If it's partnership, I'd probably ask you to direct your question to Alyssa and team. But if the mothers come to us on the MIF, the member information file, we quickly verify their gestational age and verify, if they fall into these ethnicity categories, and then we continue service. So I think this is definitely a question for Alyssa. I'm sure we all want to serve as many mothers as possible, and we would like to see that birth equity requirement kind of extended.
Yeah, so I guess my direct question to you, Miss Amy, becomes, what if I send a mom to you, but she doesn't fall in that ethnicity group, then she's ineligible? Sounds like that's probably
Yeah,
what?
so she would be ineligible for the full ECM, the Enhanced Care Management Program, but we are also a CHW provider, community health worker benefit, in case anyone, you haven't heard of it. So we can still provide that. So it's less of a longer ranging coordination program. CHW is more of just like, they ask a question, we provide one answer. So we won't turn the mothers away, but the scope of our service gets limited. Does that make sense? Oretta?
Yeah, it does. Thank you so much. Yeah, it does. Thanks.
No problem. Thanks for that. Let's move on to the next slide. This is actually a mother from our Bay Area cohort. Is it okay if I share my screen real quick? I just want to highlight one partnership mother. Okay. Brilliant. I appreciate that. So kind of give everyone a more just on the ground understanding feeling of this is a mother that we've been serving since March. So Andy is a 29-year-old Black single mother with 2 children. When she came to us, she was already postpartum. After that initial conversation with her, we identified history of depression and needs for just establishing care with her providers. She also has some social determinants of health priorities, including housing and job security. So showing you all this timeline just to show you kind of how we work with the mother and how we connect, make all the referral connections. So Andy came in on March 28th, and we were able to pretty quickly have that initial successful outreach and enroll her into the program at the beginning of April. And then a few days later, we had what we call the new mother visit. That's where we do the full comprehensive assessment and we create the care plan with the member. We submitted several referrals, housing, appointments, and jobs. On April 17th, our LCM shared several job postings and offered application support. And just based on the encounter history that I was pulling from, they were texting pretty frequently back and forth about these job opportunities. And shout out to partnership on this next item. We submitted a housing navigation referral to partnership on April 10th, and within about 12 days, partnership got back to us and approved that community supports referral, and was assigned a housing navigator from the CS provider, in this case, Harvest Healthcare Solutions. And we made sure that the member is successfully connected with the assigned housing navigator. What we see is when we're making these connections, that's where gaps can occur, links are broken. So our LCM made sure that there was 3-way calls or 3-way emails to make sure that the connection is facilitated. Moving on to April 29th, the LCM identified just these are the appointments that were needed, right? PCP, dentist, pediatrician, even for the member's children. And then moving closer to the present, the member reported landing a new job and needing to secure housing near that job. So the LCM, this is again, I emphasize that the LCM's role in liaisoning and making sure the member's case move forward, even at the assigned housing navigators on that housing navigator's desk. So our LCM was able to just continually check in with both the member as well as the assigned housing navigator to make sure the case is moving forward. Based on my last reading, it seems like they have secured a location that they want to apply to an apartment to rent, and they are at the point of securing that deposit assistance, which is why I asked that initial question about deposit clarification. And moving forward, we are continuing to check on the member every 2 weeks. And like you said, like you can see here, I'm kind of concerned about the member's mental health and how we're supporting her with addressing her history of depression. So that's going to be that's going to come up at the next biweekly check-in. So just wanted to share that. That's kind of how we approach working with a member. Would love to hear, since I'm taking up a lot of time, if you have any questions or suggestions, put them in the chat for me. I would love to hear that from you. Okay, so if you don't mind pulling up the rest of the slides, I'll just quickly wrap up. Awesome, thank you. If we move on to the next slide here, Yeah, cool. Just wanted to show you how we're kind of growing. We started out in the San Francisco Bay Area. We've only been doing this for about a year, so we're definitely learning still as we go. And this, as we have kind of developed our model from the Bay Area, we are for the next quarter, 2 quarters, we really want to turn our attention to the mothers in the more rural areas up north, like, in where our current where our Northeast area is. So definitely looking forward to future discussions with partnership, health plan, as well as anyone, on the line who's interested in just collaborating and serving more mothers. Next slide. I think we're almost there. Yeah, so just like ways to work together, we'd love to serve mothers you see, so you can refer a mother to us through a simple jot form. We also do in-person events like a community baby showers or community baby like celebration with a photographer session and all that. So would love to collaborate if you are interested in hosting something like that. We also take donations for mothers. And if you go to the next slide, yep, this is the form. I'll be sure to send it out shortly in the chat here. If you don't mind going to the last slide here. Oh yeah, this is our most recent baby shower in Solano, in the city of Fairfield, actually. Next slide, please. Yeah, so this is my email contact in case you have any questions. And let me just stop there. Any questions that I can address quickly now? Okay. All right, I will drop the information kind of referral link to us as well as my email in the chat in case anyone's have best practices they want to share with me or challenges that they've seen working with the pregnant population. Okay.
Thanks, Amy.
Thanks, Eva.
Appreciate it. Yeah, you will definitely get the slides. I will send them out, and then also in a minute I can also put the link to we have a folder that's accessible to everyone, and all of the updated slides and resources, and you can also see past slides there as well. So I'll make sure that is updated. Wanted to pause here and see if there's anything else that anyone wants to share in terms of updates, spotlights, upcoming events, meetings, or just any other successes that you'd like to share with the group. All right. Well, if anyone has anything that they think of, feel free to put it in the chat and we can always pause and highlight that. Next slide, please. All right, so now we're going to kind of do a overview of the DHCS concept paper that was released last month, and give you some information about opportunities you have to provide feedback or comments, and then also how we're kind of going to grow this conversation throughout the next session as well. Next slide, please. So in July, DHCS released the Continuing the Transformation of Medi-Cal concept paper. And for those of you that haven't seen it, the purpose of this paper is to really outline DHCS's vision and goals for the next 5 years, including what their plans are for advancing the renewal of CalAIM waivers that are set to expire in December 2026 and other initiatives. And the concept paper kind of reflects the vision for 2027 and beyond. Thanks, Amy, for putting that in the chat. So the paper, it's pretty long. So it outlines recent progress, current priorities, the department's long-term vision to strengthen and sustain Medi-Cal, and highlights, strong stakeholder partnerships and cross-sector collaboration with Medi-Cal members, CBOs, MCPs, county behavioral health plans, tribes, and other providers, and how they're all driving CalAIM's success. DHCS really highlights that they remain committed to continuing and sustaining the CalAIM initiative, and is proposing targeted enhancements that align with DHCS's Medi-Cal transformation principles and goals. And DHCS's approach really continues to reflect sort of the spirit of CalAIM, and that the goal really is to put members at the center and support providers and partners in delivering whole person care. So that's sort of the general, idea of the concept paper. And we'll get a little bit more specific if we can go to the next slide. And so this here really shows kind of the guiding principles and goals of continuing Medi-Cal's transformation. So here, what DHCS really elevated was their effort to center, or continue to center Medi-Cal members across programs and initiatives, strengthening and building on DHCS's current initiatives and accomplishments to date, really backing all of these initiatives by data and evidence, improving efficiency, and investing in initiatives that are scalable. And then we kind of just talked about all of the goals, but this kind of gives you an idea of how all of the pieces fit together and really what they're envisioning for the future of Medi-Cal. So in the next slide, we will go over some of the key highlights. Again, as I mentioned, it is a relatively lengthy concept paper, so if you have the time to go through it, great. But if not, just wanted to point out a couple of important pieces. And so in table 1, which is on page 33, if you do want to kind of go there and take a look at it, and we can put the link to the concept paper in the chat so you can look at it. This table shows an overview of the existing initiatives authorized under CalAIM section 1115 and 1915B waivers, for which DHCS will seek continued federal authority beginning January 1, 2027 through December 31, 2031. So the 12 community supports were approved as in lieu of service and are not dependent on DHCS current CalAIM section 1115 or 1915B waiver approvals. And just to clarify here that LOS is a permanent option for state Medicaid programs enshrined in federal Medicaid managed care regulations and as required by CMS memorialized and approved MCP contracts. So that's the key update for community supports. And then DHCS will seek continued federal authority for recuperative care and short-term post-hospitalization housing under the CalAIM section 1115 or 1915B waiver. So there's that update, but also another component of that is that given the rescission of CMS health-related social needs guidance from March 2025, the approval of services that provide funding for room and board will likely face challenges at the federal level. So DHCS will really need to provide significant data demonstrating the cost effectiveness of these services during waiver negotiations. But even with a demonstration of cost effectiveness, it may need to remove financing for room and board for these services and seek approval via other means. So that is another update there. And then PATH CPI will sunset in December 2026. So these are kind of the key pieces of information that we wanted to pull out from that concept paper. I do want to highlight that the 30-day public comment period closes tomorrow. So if there's anything that anyone would like to elevate in terms of feedback or comments about these updates, you're welcome to do so in this forum. We can go ahead and, elevate those to DHCS on behalf of the collaborative. But also the email is there if you would like to go ahead and submit feedback or comments by tomorrow about any of these updates. So let me just pause there really quick, see if there are any comments, any questions, reflections. I'll just pause. Anything that you think would be important to uplift to DHCS? Okay. So, and I know it's a lot of information, but if you do have any questions or just reflections or, anything that kind of comes to mind as you think about the future of Medi-Cal and CalAIM, please, we'll drop the email in the chat that you can send any feedback or comments to. So again, you have until tomorrow to do that. So if anything comes to mind, you can take a look through that concept paper. Again, the table 1 on page 33 really has a good sort of overview of the, proposed changes and the just kind of the waivers that DHCS will seek continued federal authority for. So please feel free to review that. And you can always, again, follow up with us or that email there with any comments. And feel free to put any questions in the chat if you think of anything over the next few minutes. So we can go to the next slide. So as we kind of think about the future of CalAIM, and especially in light of the information that PATH CPI will be sunsetting in December 2026, we really want to provide a space for us to think about what the future and the sustainability of this work is. PATH CPI is just one component of this work. But would really love to reflect on, what from these collaboratives should we, maybe we don't need to continue, maybe we can let go of, maybe it doesn't serve us, but what are the components that have been really helpful in strengthening the ecosystem within this region? What would we want to grow or continue strengthening as a group? And what are opportunities to advocate to continue to advance policies or funding or systems that strengthen the ecosystem and the community, and who could we partner with to do this? So these are just kind of some ways to help us kind of start thinking about sustainability and a path forward. And we'll go deeper into this conversation, as I mentioned, in our September session. And we'll have a chance to kind of dig in and then also talk about resources that are available as we think about sustainability. But first, I just want to pause here and just see if there are any initial reflections as we think about the sustainability of this work and Medi-Cal transformation in general. Thanks, Areta. Areta, anything that you want to voice over about that or any kind of reflections that you're having?
I think for me, the reflection was I find that CPI sessions help to bring more, as I said in my text, it helps to bring more in terms of clarification and definitely keeping us in the loop of when there are updates. And then of course the networking. I love that. Like even just listening to Miss Amy just now and listening to Mr. Telson, just learning more about the other agencies in our area that are working with the same program that we are, and being able to have that continuum of care and coordination of care. So I'd like to see that strengthening and moving forward. And I think that's important. So, because other than that, I keep thinking like if we didn't have this forum, like I wouldn't know about some of these programs and other agencies that are doing other programs. So that's been really helpful.
Yeah, thank you for sharing that, Areta. I think this also kind of helps think about how we can frame the conversation next month. And in terms of, the things, and I think this is consistent with a lot of conversations we've had within the collaborative, but just the value of kind of, synthesizing updates, networking with other providers in the region, and then care coordination. So we can definitely incorporate that into our conversation next month. Any other thoughts or reflections?
Yeah, I mean, obviously, there's like a lot of nervousness and uncertainty
Yeah.
when it comes to room and board services. I know us and the other agencies are a little concerned about that, especially agencies that were primarily built upon that too. So it would be great to see that continue. Access into some sort of sober living or transitional housing has been huge for this community. We've seen numbers of homelessness go down quite a bit. People have gotten a lot of help, and I just hope that they're able to communicate that in a way to DHCS that they see the value in it, because it's made a major impact.
Yeah, absolutely. And I know that those are services that we keep seeing, especially in this region, just how valuable and impactful they are. Tyler, would you be just kind of because of your perspective, would you be interested in submitting feedback about the concept paper about these services?
As much as I hate taking on extra work, yeah, I would.
Okay, because we're happy to support with that too, if that's not
No, I would absolutely love to be a part of
okay.
that.
Okay, great. Yeah. So the email's there and just let us know if we can support with any of that.
Thank you.
Yeah. Any other reflections or questions or things that you want to make sure we incorporate into future conversations? Okay, well, yeah, keep these kind of questions in the back of your mind, and think about, again, like the things that from PATH CPI that have been really helpful that, you think would be helpful and important to continue. And then maybe the things that could kind of, go to the wayside and that we wouldn't need to leverage moving forward. But I think we can move on. And you can go to the next slide. Okay, so updates about our September in-person session. It'll be on September 18th from 11 to 2 p.m. And we'll be holding it at the Partnership Health Plan office on Air Park Drive, the one by the airport. And it'll be a similar format to other in-person sessions we've had. We'll be catering lunch, and we'll be having some different activities throughout the day. We will have obviously lots of opportunities for networking, since that is something that I know is incredibly valuable, especially to this group. So we'll be doing some networking activities. I know that we enjoyed doing sort of like a networking speed dating activity during the last session, but if anyone has any other ideas about really great ways to network, we're very open. Please let me know if you have any thoughts on that. We will obviously provide updates and resources from DHCS and partnership like we usually do, hoping to incorporate a provider spotlight as well. So if you're interested in presenting a provider spotlight, or if there's a type of provider that you would like to see do a spotlight, please let me know. And then we will continue this CalAIM sustainability conversation, revisit those questions, but then we'll also have an opportunity to talk about helpful resources as we kind of think about the future of this work and CalAIM and the services that you all provide. So we'll go over some of those. We'll have some time for just a networking lunch. Everyone will get a chance to kind of, chat and just have some unstructured time to meet folks. And then similar to the justice involved panel that we did during the last session, we're going to be having a children and youth panel during the in-person session. We're going to have a variety of stakeholders that provide different services for children and youth, and we'll be talking about sort of some gaps and how different maybe entities that we don't usually incorporate into the conversations that we have in PATH CPI really can partner with ECM providers to support this population. And so we'll be talking about juvenile justice and probation, offices of education, and some other groups as well in the region. So I think that'll be a really robust and interesting conversation that I'm really excited about. And Amber will be facilitating that panel. And then, as always, we'll provide some, closeout information and next steps. Want to pause there and just see if there are any questions about the session or suggestions. Again, we're like very, very open to any suggestions that you all have.
I just had a quick question, Eva.
Yeah.
I wanted some information on the marketplace, TA marketplace.
Mhm.
I don't know if there's any updates. The last thing I got was, or rather the last information I received was that they were cutting that and you can only have one and it had to be like your first time kind of scenario. The reason I'm asking, we applied for 2 different TA marketplace, and so we're working with one person, and then the other person wasn't sure if we were eligible to be doing it still, even though we were approved long before the ruling came in effect. So that was something I was really interested in. And then 2,
Yeah.
as it relates to suggestion, I always find it very interesting if we could learn a little bit more. You'd have to like tell us in detail, but like grants available that could partner in with ECM and community support. I thought that would be like really good. Like if there's any upcoming grants
Mhm.
you can like shoot our way. I know I'm always researching if there's any grant that will fit, particularly with ECM and CalAIM, that will, especially with all the cuts and so forth. So
Yeah, no, absolutely. I've made a note of both of those topics. So I'll see if there's any room in the agenda, but also we will be having just a drop-in office hours next week. So also if these are the things that are top of mind, you can come to that office hours and we can talk a little bit about that as well.
thank
And
you.
yeah, and we'll have information about that on the next slide. But any other questions or suggestions about the in-person session? Okay, cool. And the registration link is in the chat. Please be sure to register because that's how we know who there will be a certain cutoff just because of the capacity of the room. And then also we want to know how much food to order. So please register using that link and I will also send it out as well. Next slide, please. So next steps, again, that September in-person session is on the 18th. We will be having just a drop-in office hours on August 27th at 10 a.m. So if there are any sort of ad hoc items that you would like support with, please stop by. But then as always, if that time doesn't work for you, you can always reach out to us and we can schedule a 30-minute one-on-one to kind of talk about anything that is top of mind. Well, thank you all so much for a great session. Hope you all have a great rest of your month, and then we'll see you hopefully next month for the in-person in Reading. Take care, everyone.